I want to welcome you to this webinar. This is to mark the World Cancer Day. The topic is on Close the Care Gap, the theme that has been since 2022, and it will continue to 2024, Close the Care Gap for the treatment of cancer. This webinar is being presented by Mrs. Yusuf Mercy, and it is a program to mark the World Cancer Day. It is in collaboration with OPAN and the Pharmacy Department, University of Ilorin Teaching Hospital, and Pharmaceutical Society of Nigeria, Kwara State. So I want to welcome you to it. Stay blessed and God bless you.
Good day. I'm Pharm Yusuf, intern pharmacist at University of Ilorin Teaching Hospital, and I'm presenting on World Cancer Day for the year 2023. The theme for this year is Closing the Care Gap in Cancer Through Uptake and Continuity of Treatment. The objective for this year is uniting our voices and taking action. This year focuses on building stronger alliances and new collaborations to unite the voices of like-minded people to make a powerful appeal. World Cancer Day is a global health care event for awareness of cancer, which happens every 4th of February, and this year makes it 23 years since it began. And the aim is spreading awareness and educating people about its detection, treatment, and prevention. Cancer is a disease which occurs when changes in group of normal cells within the body leads to uncontrolled abnormal growth, forming a lump called a tumor. This is true in all cases of cancer, except in leukemia. It is good to note that tumors can grow, spread into surrounding normal tissue, or to other parts of the body through the bloodstream, lymphatic system, and this can affect the digestive, nervous, and circulatory system. Going to the epidemiology, cancer is the second leading cause of death worldwide. 10 million people die from cancer every year. Out of these, 40% of these cases are preventable because we found out that they are linked to modifiable risk factors such as smoking, consumption of alcohol, poor diet, and physical inactivity. Almost at least 1/3 of all deaths related to cancer could be prevented through routine screening and early detection and treatment. 70% of cancer deaths occur in low-middle-income countries. The risk factors include obesity, tobacco, alcohol, sedentary lifestyle, poor diet, excessive UV exposure, carcinogenic chemicals, age, genetics, and radiation. There are signs that are associated with cancer. However, these signs do not automatically mean that cancer diagnosis. It will still be good to go for screening. However, these signs are common in cancer: pain, extreme fatigue, unexplained weight changes, swelling or lumps, skin changes. Cancer can be prevented. Between 30 to 50% of cancer cases are preventable. Prevention offers the most cost-effective long-term strategy for control of cancer. There are steps to take to reduce our risk of cancer. This includes healthy diet, breastfeeding, vaccination, limitation of alcohol consumption, being physically active, and not involving in smoking. Cancer treatment options are many. This includes hormone therapy, surgery, bone marrow transplantation, chemotherapy, targeted therapy, radiation therapy, immunotherapy. Now to chemotherapy. Chemotherapy is a drug treatment that uses strong anti-cancer drugs to kill rapidly growing cells in the body. This procedure is generally used for cancer treatment because cancer cells grow and multiply much quicker than regular cells. The goal of treatment is to cure, to prolong life, to palliate, and in some cases, to experiment. There are factors to consider in determining treatment goals. This includes type of cancer and extent of involvement, treatment goals, age, performance status, concomitant diseases, social and economic factors, patients' or families' wishes, and many of other factors can be considered in determining treatment goal. Now, factors affecting the uptake of treatment. This includes the cost of treatment, which is high, and then treatments are not available in some cases, side effect of therapy, belief system, poverty, health system, culture factor, and income status of patients. Now, the question is, how do I know whether my treatment is going on well or not? There are ways to evaluate treatment response. This includes response, survival, tumor marker, and quality of life. The response can either be complete, partial, or you still find out that the disease is stable. In survival, it can be overall survival or progression-free survival. The role of pharmacists. Pharmacists have a huge role to play, and this includes explaining how medication works, reinforcing how the medication is to be taken, reviewing what side effects might occur, recommending financial resources, patient counseling, ensuring availability of safe and affordable drugs, and also reconstitution of drugs. I would like to bring on Dr. Mrs. Williams.
Thank you so much, Mrs. Mercy Yusuf Ismaila. I'm Dr. Felicia Esemekiwari Williams of the Department of Clinical Pharmacy and Pharmacy Practice, Faculty of Pharmaceutical Sciences, University of Ilorin. I'm the Chairperson, Education Committee of Oncology Pharmacy Practitioners of Nigeria. I want to emphasize on the challenges that are encountered with cancer treatment. One of the challenges that we have is the denial system of the individual, the belief system. Most individuals believe that it is not my portion. This cancer is returned to sender. And as a result, we have delayed presentation. But one of the key areas we want to look at for us to have successful management of cancer is early detection. And if the patient does not present on time, we are going to have challenges of early detection. So as pharmacists, we are creating awareness that cancer detection is not death sentence. Rather, with early detection, we can have better prognosis of cancer management. Another challenge has to do with access to cancer care. With this year's theme, closing the gap, the care gap, all of us are supposed to unite our voices, our efforts to ensure that cancer care gap is closed. But access to cancer medicines or treatment is a challenge. Poverty is a problem, and medication availability, affordability is another challenge that we want to ensure that we do our part to ensure that patients have access to care. On the part of the patient, it's a community effort. The caregiver, they need to provide the necessary emotional, psychological, financial support to ensure that patients have access to cancer care. On the part of pharmacists, we also want to be available to offer necessary counseling so that patients will not abandon their treatment, accept, uptake, and maintain cancer treatment care. Before the commencement of cancer treatment, patients are given proper counseling as regards for chemotherapy, the challenges they are going to encounter with regards to side effects. So when they are properly counseled and they start observing these side effects, they are encouraged to continue with the medication. They do not abandon their treatment. Then availability of medicines, the government is making a lot of efforts through the NHIS program of increasing the number of cancer medicines on the essential medicine list. So as a community, all of us are stakeholders in ensuring that cancer care gap is closed. Then, what of the use of herbal products? Some individuals, due to the denial system or belief system, they go to access care through the use of herbal products. We know as pharmacists that we have interaction between orthodox medicines and herbal products. We do not we do not want to combine the use of those two approaches to care, because when we use herbal products along with orthodox medicine, the herbal product can either make the orthodox medicine more toxic or less effective. So as a group, the take-home message is early detection, access care as early as possible. We should not allow the belief system to make patients to run away from treatment. They must continue to be encouraged so that they will continue to access their care so that we can close the gap of cancer care. Thank you so much.
All right, with this, we come to the end of presentation for World Cancer Day, and know that cancer diagnosis is not a death sentence. Thank you.